Well, several studies investigate the maintenance of targeted therapies in combination with chemo versus a pause or versus targeted therapy only. Could you summarize the main results of these studies?
If we look on the results of maintenance therapy in that field of metastatic colorectal cancer, we can say that probably giving targeted therapy is better than nothing. It's sure. Probably it works in some patients and not in other patients. Bevacizumab has been studied very largely, I would say, with different trials. And it seems that combination of capecitabine and bevacizumab is the most active regimen, as it has been reported by KERO-3 trial. Concerning cetuximab, at this time there is no data. There is some very preliminary data, especially that have been published this year, the COIN trial, suggesting that cetuximab could be active in that setting, but we are waiting for the large randomized trial. So I would say for patients, we have to decide if we prefer for them pause or maintenance. If we do maintenance, for me the best treatment seems to be a combination of capecitabine with continuous administration of capecitabine, as it has been done in KERO-3 trial, plus bevacizumab.
Well, will these studies impact clinical practice?
I think that these studies could have an impact on clinical practice. We know now that it is possible in these patients to obtain very long median survival, more than 30 months. And we are sure that it is impossible to give during 28 or 29 months aggressive chemotherapy to these patients. So at one moment or another one, we will have to decrease a little bit the intensity of the treatment that we are giving to patients. So again, there are two possibilities. Probably if it is a quite slow-growing disease, we may propose moments of complete pause, but in other patients, if the tumor is a little bit more aggressive, we will be able to be a little bit aggressive for the patient in terms of quality of life, decrease the level of intensity of the treatment, and move from FOLFOX or FOLFIRI bevacizumab, for instance, to capecitabine bevacizumab with a continuous administration of capecitabine. That seems to be a very good option for these patients.